wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. I have so many individuals, women, that have questions about tubal ligation and symptoms that occur, adverse health symptoms that occur after they've had tubal ligations. I've done numerous podcasts on tubal ligations, and they are one of our most popular podcasts, so know it's a significant problem. Let me give you just a few statistics first. About somewhere in the order of 700,000 women every year have a tubal ligation. The tubal ligation is where the ovarian fallopian tubes from the ovary to the uterus are tied or clamped or cut. And remember, the fallopian tube is the tube that carries the egg from the ovary into the uterus where it is waiting to be fertilized. And so if a woman wants to prevent further pregnancies, one means besides birth control pills that they use, or IUDs, will be to have a tubal ligation. And as I mentioned, it's a very common procedure. There's a problem, though, with post-tubal ligation syndrome. And unfortunately, many of the physicians that perform the tubal ligations, and they're going to be primarily obstetrician gynecologists, fail to inform their women patients that there are side effects that will frequently occur after the tubal ligation. And those symptoms can be symptoms that are caused by low progesterone levels. And let me explain. When you cut the fallopian tubes, you cut off part of the circulation to the ovaries. You've got two ovaries, one on each side of the uterus. And those ovaries, both ovaries are connected to the uterus by fallopian tubes. So when you cut or tie off the fallopian tube, you're tying off part of the blood supply to the ovary. So it only has ovarian artery rather than uterine and ovarian artery. This can cause abnormal hormone production by the ovaries. And the hormone that frequently declines most dramatically is progesterone. So let me explain what decline in progesterone and hormonal imbalance can mean to you from a physical point of view. And this may happen within a few months to several years after the procedure, after the tubal ligation. So in a normal ovary, every month, the ovary is producing for the first, or really all month long until the menstrual period, it produces estrogen. Estrogen hormone proliferates the inner lining of the uterus. In mid-cycle, and the cycles normally would be in a perfect world 28 days, so at mid-cycle, day 14 or day 15, the ovary will produce an egg, and the egg will then be propagated and moved down the fallopian tube into the uterus. That area where the egg arose from is called the corpus luteum, and it produces progesterone. So we have estrogen hormones that are proliferating in the inner lining of the womb. Progesterone then balances that out and matures the inner lining of the womb. It promotes gestation, which is pregnancy. That's what progesterone does. So, and during the month, you have the production of the estrogen proliferation in the inner lining of the womb, and then you have production of progesterone to mature the inner lining of the womb and balance it out. When those hormones become imbalanced, when progesterone levels decline, whether you've had a tubal ligation or not, but it'll happen commonly after the tubal ligation, whenever that was done, all of a sudden you begin to have a change in your menstrual cycle. So because you're making more estrogen is out of balance with progesterone, you're proliferating the inner lining of the womb, and your periods can become longer and longer. They go from 3 to 5 days, maybe to 5 to 7 days, 7 to 9 days. you get heavier periods, you get clotting, you get cramping, you get premenstrual symptoms with anxiety and mood swings, maybe some depression, irritability. And then you can get breast tenderness, you can get fluid retention, you can get weight gain, you can get headaches. All these are premenstrual symptoms, which will oftentimes develop after a tubal ligation. They can develop years before. This is not uncommon after women have children, after their first, second, or third, or fourth child. They can develop these symptoms because as they get older, even without a tubal ligation, the ovaries begin to decline in their hormone production. So a woman goes through her menstrual life from puberty to menopause, and that may take 30 or 35 or 40 years, depending from woman to woman. But sometime in that, she's going to go through puberty somewhere maybe between around 12, 13 years of age, 14, and menopause would be on an average at around 50 years of age. So you've got 35 years of menstrual cycles that women have. And during that time, the hormones are trying to get balanced out, and a woman matures. Once she gets into her 20s, she's most fertile. And then as she matures and gets into her 30s and early 40s, the ovaries begin to decline in function, and they have anovulatory cycles. That means they don't ovulate every month, and you can have different changes. So if you don't ovulate in a month, all you have is estrogen. You may have heavier periods with cramping one month, and then it normalizes the next month. So when you have a tubal ligation, it's going to put you on a fast track to early menopause because your ovaries are not going to receive the blood flow they need to produce the hormones naturally. And so you end up telling your doctor, I just feel terrible. My periods aren't right. Next thing you know, he's got another procedure for you, and that could be a hysterectomy. And he can say, well, we can stop the abnormal bleeding. We'll just do a hysterectomy. Well, it does stop the abnormal bleeding, but it doesn't stop the cause of the abnormal bleeding. And they may take your ovaries out at that time. And then right now, you've got no hormones whatsoever. And they give you some counterfeit hormones, Premarin or some progestin, which is a counterfeit progesterone. They put you on that, and you have all these, they're not natural, so you have symptoms associated with it. You may have headaches, mood swings, fluid retention, depression, weight gain. All these will also depress your ability to utilize thyroid hormones, which are your body's spark plugs, which enable the cells to produce and use energy. And so if you're not producing enough energy in your cells, you're going to be fatigued, you're going to have brain fog, you're going to have weight gain, you're going to get puffy and pale, you're going to get hair loss, you're going to get sluggish bowels, loss of romantic moods and inclination. You're just going to feel lousy. You're going to feel sick and tired. You're going to be sick and tired of being sick and tired. And all that has to do because your female hormones have become imbalanced. One of the causes, of course, is tubal ligation. The other cause is just the natural aging process. And then you go through the hysterectomy, and you may have a total hysterectomy where they take, it's called total, or total hysterectomy is really when you take out the uterus. The proper term is total hysterectomy and bilateral oophorectomy, and that means bilateral removal of the ovaries. So when that's done, you go into surgical menopause right away. So I want to encourage you, if you've had a tubal ligation and you're suffering from symptoms, premenstrual symptoms, irregular periods, cramping, bloating, headaches, breast tenderness, mood swings, fluid retention, depression, anxiety, sleepless nights, brain fog, that is going to have been caused because your ovaries are not receiving the right amount of blood necessary for them to balance out your hormones. And you can be placed on natural progesterone, and that will balance that out, and that can prevent you from getting a hysterectomy. Also, if you're having those symptoms of premenstrual symptoms with the heavier periods and all the symptoms I just described are premenstrual symptoms, and you're having them from a day or 2 days before your period starts to 4 days to a week to 2 weeks, all that can be easily corrected by taking natural bioidentical progesterone. So when we replenish hormones in females and in males, we use the same identical hormones that the body made naturally. So they're natural hormones and they cannot be patented. Drug companies don't like that. They want to patent their hormones, so they put in different chemical structures in the hormones, which means they're no longer natural and the body doesn't utilize them like it does natural hormones, and they can come with a host of side effects. Birth control pills are one type of unnatural counterfeit hormones, as are the postmenopausal drugs, Premarin, which is horse estrogen, and the progesterones, Prempro, which contains Provera, which is an abnormal progesterone. So you want to be on the natural bioidentical hormones. We've only been using them here. I started using them here at the center in 1996 and have had tremendous success, and we've treated tens of thousands of women with natural bioidentical hormones to help balance out their hormones so that they have energy, vitality, and enthusiasm for life. We do the same in men as well by replenishing their testosterone decline with natural testosterone. But that's a time, there's another time for that story on a podcast when we talk about male hormone supplementation. So if you're considering having a tubal ligation, know that it's going to come with some side effects, which can be easily treated to help preventing you from getting the next step, which is a hysterectomy. If you're having menstrual problems now and haven't had a tubal ligation, but you're having menstrual irregularities and premenstrual symptoms and they're not getting better, and the doctor says, well, this is natural, we can do a hysterectomy on you and solve the problem, that won't solve the problem. Solve the problem by taking natural bioidentical hormones and not letting the doctor take your organs out. I'll tell you a quick story. I was in training back in my internship. This goes back 50 years. And there was an OB-GYN that I was working under, training under him for a period of time. And he told me that he goes from room to room. They're only seeing women, mind you. They're obstetrician gynecologists. And he goes and he prospects for hysterectomies. That's how they make their money. He's prospecting for hysterectomies. And OB-GYN makes their money the first half of their career delivering babies, the second half of their career doing hysterectomies. So he was out there prospecting. Well, I don't want you to be in an office where somebody's prospecting to remove your womb, your uterus. Get yourself on natural bioidentical hormones, and you can go through the change of life very simply without any significant problems and keep your organs. That's what I recommend. Thank you for giving me a time to be with you today. Remember, balanced hormones are going to lead you to have a life full of energy, vitality, and enthusiasm. And that's what we want for you. If you have any questions, don't hesitate to contact us here at the Hotze Health and Wellness Center, 281-698-8698. Thanks so much for joining us today.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom-made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.